Have you been diagnosed with high blood pressure or worried about high blood pressure? Maybe you're not quite ready to start medication forever. So hear me out. Here are some potential ways to not end up on prescription medications for hypertension. I'm Dr. Rishori, family medicine physician turned health coach, and high blood pressure is one of the most common things I deal with in my practice and in my health coaching. In this video, we're going to talk about some of the lifestyle changes that have been proven to effectively lower high blood pressure and also hopefully help you prevent it in the future. Now, again, not everyone's going to be able to do this, and some of you may end up needing to take medication either for a while or maybe lifelong. But either way, these things are incredibly effective at lowering your blood pressure, even if you're on medication, or hopefully prevent it from ever happening in the first place. Blood pressure can happen for several reasons, though genetics seems to be the leading cause. And we know that even if you have a genetic predisposition for a chronic condition like diabetes or hypertension, high blood pressure, there are many things that you can do to lower this risk. And there are 4 categories that we're going to focus on today, which is actually part of my trend framework. So T stands for testing. This is where we always test to know what changes to make. The R stands for relationships. The E stands for exercise. The N is nutrition. And D is downtime. Now, every single person is going to need a specific approach to help them achieve their ideal blood pressure goals and their ideal, hopefully, hypertension prevention strategy. But maybe this will help you know exactly what you should do in your case. The first question should be, can you even attempt lifestyle changes? Look, if your blood pressure is 200 over 120, chances are it's necessary for you to be on blood pressure meds, at least for the foreseeable future. But if your blood pressure is in the 140 to 160 or 80 to 95 range on the diastolic side, and if your kidney function test, this is your serum creatinine, and your cholesterol test, which is your serum LDL-C or LDL, as long as these two are not abnormal, if they're in a good range, chances are that you can attempt some of these lifestyle changes, of course, with the guidance of your own physician. If you have abnormal kidneys, if you have very high cholesterol, again, the risk is too high to not take any prescription medication, but it doesn't mean that you have to be on those prescriptions for life. You can still try these lifestyle changes and hopefully come off of those medications in the future. If I were to start with any generic health coaching client, this is where I would start. Number 1 would be relationships. Why? Because if you're socializing, if you have a good romantic partner, if you're in good relationships with your parents, with your significant other, with your friends, chances are you have a lower overall cortisol level, which means lower catecholamines, epinephrine, norepinephrine. So you're much more likely to have a lower blood pressure and to keep that blood pressure low. The second one in our trend framework is going to be exercise, specifically isometric exercises where you hold your bicep and forearm in flexion for 30 seconds at a time. You can even do wall sits for your glutes. Doing that every single day of the week, doesn't have to be long, it could be just a minute or two, has been shown to drastically lower your blood pressure. On top of that, in the exercise category is something aerobic, going for a walk every day, doing a hike every day. If you can't do it every day, at least every other day, the goal is to get your zone 2 aerobic capacity up, which will help you lower your blood pressure because your heart doesn't have to work quite as hard. The third one on the list is N, is nutrition. So nutrition, really 2 places you want to focus on: getting a lot of potassium and fiber in your diet. So think about legumes, beans, corn, even peas, potatoes, of course, kale, cauliflower, broccoli. These are great vegetables with lots of potassium and plenty of fiber to feed your gut bacteria. And the things you want to avoid would be a lot of alcohol, sugar, pretty much anything with refined carbs. So with sugar, of course, I mean any kind of sugar, whether it's date sugar or molasses or maple syrup. And refined carbs, we're talking about white rice, we're talking about chips, we're talking about most packaged foods, and we're talking about white flour. Ideally, you always want to have 100% whole grain flour, whole grains like brown rice. That's always the best thing for your gut to help you lower your blood pressure. The last one is D, which is downtime. So this is the way we actually relax and calm ourselves. And downtime is getting enough sleep and also doing some meditation and breathing exercises throughout the day. Both of those have been shown to drastically lower your blood pressure, keep your blood pressure low, so that hopefully you don't have to end up on medications in the future. Remember that the goal is to slowly reduce your blood pressure numbers. You're not going to see overnight changes, but every single day, get a blood pressure cuff, check your numbers, see how it's doing, and just focus on the average. One day, your blood pressure is just going to be super high. Another day, it's going to be normal. The average throughout the week is what we care about. So try these things, work together with your physician. And if you're looking for a health coach to work with you privately one-on-one, I'm Dr. Ashori, family medicine physician turned health coach, and you can find out more information in the description or in the bio to work with me one-on-one. And tell me, what is it that you're dealing with? Whether you've been diagnosed with high blood pressure or you have family members with high blood pressure, what in this video resonated with you? Comment below. I would love to start that conversation.